Hello. Present here. Today, with immense pleasure, I would like to welcome our chief guest of the day, Dr. Anish Desai, the Director, Medical Affairs and Clinical Operations at Johnson & Johnson Medical India. I would also like to welcome Dr. Kingsley Singh, the Director, Engineering and Technology in charge, the Head of the Department of Biomedical Engineering, Dr. Anburajan, and all the delegates present here, the faculty and the friends, and my friends. A very good afternoon to all of you again. Today, we are privileged here to have among us an eminent personality, one of the top executives from the medical industry. It is none other than Dr. Anish Desai, the Director, Medical Affairs and Clinical Operations at Johnson & Johnson Medical India. He is one of the members of our Corporate Advisory Board, and today he is here to interact with us all. I would like to again extend a warm welcome to you, sir, on behalf of the Department of Biomedical Engineering, SRM University. Welcome you, sir. It will be my pleasure to give you all a brief introduction about him. Dr. Anish Desai is an experienced clinical pharmacologist and pharmaceutical physician. He has an experience of over 22 years in the industry of pharmaceutical and medical devices. He has always been associated with academia, research as well as industry. All through his career, he has displayed his skills in handling medical affairs, pharmacovigilance, regulatory affairs, and above all, he has been a clinical researcher. He has a number of well-published papers in the field of drug development and NCE, new chemical entity development. It would not be a surprise if I tell you, he has also been serving as faculty in a number of institutions. To glance through his educational background, he did his MBBS Medicine and Surgery by 1993 from Grand Medical College and Sir J.J. Group of Hospitals. His MD was at St. G.S. Medical College and KEM Hospital in the tenure 1990 to 1993, where he also served as the Resident Medical Officer in the Department of Clinical Pharmacology. His career timeline has been really eye-catchy. He started off his career as Assistant Professor at St. G.S. Medical College and KEM Hospital in 1992. His entry to the industry was as Medical Advisor, JB Chemicals and Pharmaceuticals, where he served as a period of 2 years. And then he was the Medical Advisor at Ron Holland India Limited from 1996 to 1998. Serving as the Manager of Medical and Regulatory Affairs of South Asia, USB India. He served there for a period of 1 year. Then he was the Vice President, Medical and Clinical Development, Glenmark Pharmaceuticals for a period of 7 years. It was his next tenure of 1 year as Vice President of Medical Affairs at Unichem Laboratories Limited. He also has served as the Medical Director, Global Medical Affairs and Pharmacovigilance at Bristol Myers Squibb, India. After that, he got the post as Head R&D Medical Director, Bayer Healthcare and Bayer Sharing Pharma, where he worked almost 3 years. He was the head for the medical, regulatory and clinical operations. Since 2010, he has been working with the Johnson & Johnson Medical India as the Director, Medical Affairs and Clinical Operations. He has received a lot of honors and awards through his career, and to quote a few, he was given the UK Shade Award for the Best Paper in the year 1994. He is also recipient of the 2004 Charles R. Ream Award of Excellence. He has also been chosen the Fellow of American College of Clinical Pharmacology, United States of America, and the Fellow of Royal Society of Medicine in London. Since the last 15 years, he has been playing a major role as the senior management in the medical industry at different companies in the medical industry and also the pharmacological industry. We are here lucky to have such an eminent personality among us. Without any delay, as we are all waiting eagerly for him, I would like to hand over the dais to him. welcome you upon the dais. Dr. Kingsley, to give a memento to our Honorable Chief Guest. Welcome.
In fact, I'm not here to teach you anything, but just to share my experiences in the industry, and that's what I was discussing with your esteemed faculty as to what I plan to do with you in next probably half an hour, and maybe I can have an interactive discussion. Since you are into biomedical engineering, which is a group which deals with healthcare, I would like to give you some of the nuances of the healthcare setup, what exactly are clinical practice, what exactly is happening in the area of clinical research, and where exactly and how do you really need to look at it. When you are looking at any kind of development which is related to healthcare, one of the major issues that keeps on happening is that there are regulations, and therefore you need to be aware of it. How are you really going to look at the regulations? And it's an entire circle when you're looking at the entire healthcare industry. It's right from innovation, R&D, then to regulations, commercialization, and finally then looking at what exactly is the marketing objective. So that's how the industry looks at it. So these are few of the things that you look at it, and one of the critical things which I'm going to discuss with you today that keeps on happening and that has happened in the industry, that is the healthcare industry, is basically evidence generation and evidence-based medicine. What used to happen in the earlier period is that the doctors would be there, the patients would go to them, and the doctors would have learned their medicine, practiced it over a period of time, and they would implement it. And it was based on his or her experience. However, over a period of time, what has happened is that medicine has evolved quite a bit. It has undergone quite a bit of change. There has been developments, there have been innovations in the space of biomedical engineering, genetic engineering, stem cell research. At the same time, one of the objections that we see, and if you will be reading the newspapers that is coming up, people are talking about affordability of healthcare. So therefore, the important aspect is that the kind of healthcare products that I develop, or you as researchers would be developing, what exactly is the impact of those healthcare products on the outcomes that a patient wants to see or the patient's relative wants to see. If you are a patient and you have a particular disease, you would like to get relief from that disease. That is your major kind of objective. At the same time, if we look at the Indian setup, and that is one of the important aspects which I was discussing with your faculty, is that the affordability is a major issue. The government is coming with a lot of insurance schemes, and therefore whatever clinical innovations are happening needs to be cost effective, and therefore economic outcomes are also very important. And that's how the whole process has evolved. Can I have the next slide, please? And this is what I was saying. If you look at a paradigm shift in medical practice in the past, it was basically don't question, follow the teacher. So the teacher would tell in the medical college that this is how medicine is practiced, and all his students would follow it. Wait and watch. Resident knowledge of the physician. So my technique is the best. So it was basically based on highly individualistic approach. And there are even today several physicians and surgeons, when I go to talk to them, they say that it is in my experience. And that has changed quite a bit if you look at it. Learn, reason, assimilate, and deploy. It is becoming now predictability driven. It is not personality driven. If I give a particular medicine or if I use a particular device, what are the changes that are going to happen? How predictable the changes are there? In fact, one of the questions all of you may ask if you go to a doctor, yourself or along with your relatives, doctor, what is going to be the impact? Am I going to be cured? And that is the answer you want, and that is the answer which each and every physician has to answer. And that's what is coming up in a great way at this point of time. We are also looking at available at organizational level guidelines and policies, checklists and gold standards. So we have gone into a kind of a process now. We are looking at, if you look at this institute, it has got certain policies, it has got certain procedures which are followed, and similarly the medical practice also needs to be followed. And this is the play. As I go forward, I will explain to you why I wanted to take this up as a topic. One of the major issues today in India that is happening is that we do not have, or we as, even if we are doing research, we do not document it, number one. Even if we document it, we do not publish it. And at the same time, when we start our research, many of the medical research do not have their own patents. And that's where the ownership issues come up. Therefore, it's all to do with adopting and adapting to a process, going ahead and taking care of your research work, because your research work is your intellectual property. And that is going to put you into a different kind of sphere. I know a lot of physicians and surgeons who are excellent doctors. However, they have treated probably thousands of patients. However, many times when they go at international forums, one of the questions that is asked to them is that, doctor, what is the data that you are available on your research that you are talking of, on your experiences? And that's where we falter. And that's where you have to look at something called as evidence-based medicine. Next. What exactly does evidence-based medicine imply means? And what do we, and what does mean medical papers or publications, what does that mean? Next slide. In fact, when we talk of evidence-based medicine, it is actually an interaction of three circles when we look at it. It is clinical evidence, it is research evidence, and it is basically patient evidence. And all put together, what exactly is your final outcome? At the end of the day, nobody wants to see big things. The patient is interested in treating or rather getting his ailment treated. The physician is interested in treating the ailment of the patient, and the relatives want to see their person back home in a good condition. So that's what is all there, and that's finally is there, is that to get the best available solution that can be there for treatment of a particular disease. Next slide. Next slide. Now, what is the evidence? What is the physician, the treating physician looking for? And this is how the change has happened today, and this is what you have to understand, that why different levels of evidence. And it's going to imply to you, because you are going to go into research. Some of you may go into different kinds of areas, and what exactly is that? So the physician is looking for efficacy. Efficacy means effectiveness. If I use this device, if I use this methodology, how is my patient going to be treated? How is my patient going to feel? That's how exactly he is looking at it. Sorry. Just excuse me for a moment. And the second and the most important point he's looking for is the safety of it. Is the medication, and what exactly when you go to a doctor and he prescribes a medicine, what do you ask? Is it safe? Am I going to have any side effects? That's the question which is there. So that is what he is interested in. In terms, it's okay. Don't bother. Second, next slide. What exactly is the patient looking for, and the policy maker? The provider. The provider is the hospital, or it is basically the insurance companies, or it is the government. What are they looking for? They are looking for evidence and economic evidence. That clinically, do I get superior outcomes? If I use, say, methodology A, it gives me one outcome. And if I use this new methodology, I get a second outcome. So is the second outcome better than the earlier outcome? The second and the most important question which is being asked, because there is so much of pressure on pricing, is that what is the cost? If you see today, there are large costs being applied to oncology treatment. In fact, you would have read every day there are something coming on patents, that the cost of medication is going high. Some of the innovative medications are very expensive. So that's all what is going on today. So, and these people, the policy makers, which is the government or the hospital, has to take care of a large population. They are not only looking at one patient. So if they have, say, let's say 100 rupees, and if they have to take care of 20 patients, they have to see that how effectively they can treat 20 patients and probably tomorrow 30 patients in maybe a incremental budget. So that's what is very important, and that's what the policy makers are looking for. Next slide. And then finally, when we look at it, what exactly is the patient and the payer? When you are paying from your pocket, what are you looking for? That how effective it is.